Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor, Madison365, with your daily coronavirus and other news update. If you have any questions, feel free to drop them in the comments, and I'll get to those that I can, as many as I can. The news today is once again back to being not so good. Yesterday was a decent day in terms of coronavirus numbers in Wisconsin. Today, not so much. We did have a lot of tests processed today. Over 15,000 tests, which is that's good. We like more tests is always better. Ideally, when you have more tests, your percentage of positive results should go down. Even if more tests causes you to find more cases, more tests should mean more negative tests than positive tests. So your positive percentage should go down. That's not what happened today. Today went up to 6.9%, which is not terrible. It wasn't long ago. The last couple of weekends has been over 10%. So 6.9 is still lower than 10. We're still sort of in that mitigation phase. By now, we really should have it suppressed. It should be below 3, but public health folks would tell you that to be under 10% means you're still kind of mitigating, and you're not quite at that suppression stage yet. So 6.9 is not great. The fact that it's higher than yesterday is not great. It is not entirely terrible either. Now, that 15,000 tests yielded 1,052 positive results. That's the second time we've been over 1,000. That's the second highest total for a single day that we've had throughout this crisis. Our highest was 1,172 earlier this week. Our case total now, 45,899. So we will, if we keep going this way, by this time tomorrow, we'll be approaching 47,000, which means if we keep going this way, we will pass 50,000 by Monday or so. As always, Jennifer, I will get to the local information in just a minute. We typically, I'll talk through the state numbers first, and then we'll get down to the counties. Dane County had a pretty good day today. I'll just say that right now. Statewide active cases, 9,500, which is about 200 more than yesterday. So yesterday, the number of active cases went down a little bit, which was encouraging. Today, they're back up, which is sort of like, ugh. So again, that's the highest it's ever been. That means about 20% of all the positive cases are still active, considered active by the state, which means they've been they've been diagnosed in the past 30 days. So those are all active and infectious, right? So you'd rather have that number going down, but it's not. Okay, we had 13 fatalities today, too. That was the other bad news. 5 of those in Milwaukee County, 2 each in Brown and Kenosha counties, and 1 each in Eau Claire, Outagamie, Winnebago, and Walworth counties. So the statewide death toll is now 865. Again, those aren't 13 people who died today. Those are just the 13 that we had confirmed today, which it takes. It's what we're learning now, which we didn't know earlier, was it takes up to as many as like 5 days to get that fatality reported into the DHS numbers. So those people who have passed away over the past week, basically. I do expect to see continued numbers like that 13 in a day for the next few weeks. Yeah, in fact, Rachel, thank you for mentioning that. That's a good point. We didn't used to do this because throughout most of June, Dane County was getting like 1 or 2 new cases every day, and it just wasn't. Everything was kind of fine. So we didn't do a daily update for just Dane County, and then Dane County started to kind of go sideways. So we've been doing a daily update of Dane County as well. I'm going to drop a link into the comments right now. So there you have that. Thanks for mentioning that, Rachel. So, but let's do get into the local spots here. Milwaukee County, really rough day today. 420 new cases in Milwaukee County. And that's a 13.6% positive test rate. So Milwaukee County has been having a really, really hard time. The city of Milwaukee has recently implemented a mask order so that, we might, if that starts to have an effect, it takes a couple weeks for that to have an effect probably. Or at least it should have an immediate effect, but we won't see that effect in the data for a couple weeks. So I'm hoping that those numbers will start to go down in a couple weeks, but we'll see. A few other spots that warrant attention. Brown County, 38 new cases and 8.5% positive tests. I'm going to tell you the counties that have the higher percentage rate, because that's a significant concern. So Brown County at 8.5%, 38 new cases. Kenosha County, 42 new cases and 23% positive cases. La Crosse County, 12 cases, 33% positive tests. So in other words, 36 tests and 12 of them were positive. Marathon County, 22 cases, 10.5%. Walworth County, only 10 new cases, but 16% positive tests. And Winnebago County, 17 cases, 11% positive tests. A few other spots, Dane County, our numbers this morning was 43 cases. The state's reporting 36. So that just has to do with sort of time of day of reporting. But either way, it was less than 2% positive tests in Dane County, which is good. Eau Claire County, 12 new cases, but only 2.5%. Jefferson County, 12 new cases. Outagamie County, 25 new cases. Ozaukee County, 18. Racine County, 55 new cases, but only 4% positive tests. Rock County, 16 cases. Sheboygan County, 14. Waukesha County, 92 new cases. They had 91 yesterday and 92 today, but only 5.7% positive tests. Not terrible. Waupaca County, 11 cases, 5%. Wood County, 12 cases and 7% positive. So those are all that are basically, they seem like large numbers of cases, these double-digit increases in cases for a county, but the percentage of positive tests is below the state average. So not quite as much of a concern. We have another day where we don't really have full hospitalization data because you remember the Trump administration has asked that data be sent or be reported to the Department of Health and Human Services instead of the Center for Disease Control. And apparently, I didn't think that would affect us because they're still going to report to the state regardless of which federal agency they report to. But it does seem that HHS wants the data in a slightly different form. I'm not sure what that means in sort of technical, practical terms, but that's what we're being told. So it sounds like while they make that shift to the different way of reporting the data, we're kind of going to not have hospitalization data, the full hospitalization data for a couple of days. We're hoping that gets back to normal, by Monday or so. But for now, we don't know how many people are currently in the hospital, but we do know that 48 more people were admitted today. What we don't know is how many people were discharged. So we don't know the full current number of people that are hospitalized with COVID. We do know that there were 48 new hospitalizations today. And we also know that a lot of them are older, which is sort of to be expected. But what's happening is, what seems to me to be happening, did I freeze up on you? Okay, I froze up myself for a second there. So what seems to be happening is we have almost 3 weeks ago now, 2.5 weeks ago now, right around July 4th, we start to see an increase in the number of cases. 2 weeks later, we start to see an increase in hospitalizations. Earlier, the cases were really growing in the people in their 20s. Now we're starting to see that growth in older people as well. So it's like people in their 20s are catching it, taking it home, spreading it around to relatives and other people in the community. So the 48 people who are hospitalized today, 9 were in their 60s, 15 in their 70s, and 7 in their 80s. We know those folks are more vulnerable, probably more likely to be hospitalized just as a matter of sort of more precaution. I would expect that doctors would be more sort of err on the side of caution for people that age, so that might be part of that, of why they're being hospitalized as well. Racial disparities continue to be the issue, although they're not as bad. It seems that the current surge these past couple of weeks has been slightly more proportional to the population in terms of race and ethnicity, which has started to, so the overall numbers have started to drift a little bit closer to proportion of population, although not fully yet, obviously. Latinos make up 7% of the population, but 26% of coronavirus cases. So that's still wildly disproportionate. However, that was 33% not too long ago. So let's, before we pat ourselves on the back for being so equitable, it's still bad. 26% versus 7%, still very bad. 12% of deaths are Latino, which is more than their share of the population. Black people make up 6% of the population, 16% of the coronavirus cases, and 23% of the deaths. So those are still pretty bad. One more statistical thing to mention. Rate of transmission is slightly lower than yesterday, 1.06. So for every 100 people who have it, they will pass it on to 106 people. So then you'll have 206 people infected. Does that make sense? So every next round of infection will be slightly larger than the one before, but only slightly larger. It will continue to spread at the rate of transmission of 1.06. It will continue to spread, but slower than it was before. A couple weeks ago, that was like 1.35. We were the top rate of transmission in the country for a day. So 1.06 is better. Still not great. We still need to be lower than 1 for our numbers to really continue to go down. Okay, so that's all I have for statistics, really. I have a couple other things I want to mention, and if you have any questions on any of this, feel free to drop them in the comments there, as Jennifer did, asking about local Dane County. I did speak with. I don't have the story on the website yet. It'll be up tomorrow morning. But I spoke with a data analyst from Public Health Madison-Dane County. I spoke with an epidemiologist from the UW-Madison School of Medicine. And I spoke with a population scientist. Asking the question, I didn't ask them to make a policy recommendation. I didn't ask them, should we open schools? But I asked them, we hear somewhat contradictory sometimes information from media and from social media and from our peers about whether or not children can get COVID and whether they can transmit it. And I just want you to have all the information and the facts as you're thinking about school for your kids. And as your local school districts are deciding what to do. A lot of the Dane County school districts have already decided going all virtual for at least the first quarter. And some other school districts are deciding different things. So here's what we know. If you ask the question, can children get coronavirus? The answer is unequivocally yes, they can. It does not affect them typically as much. Kids under the age of 10, and this is out of my territory, this is biological. There is a receptor called an ACE2 receptor. I don't know what ACE stands for, ACE2 receptor. That's a part of a cell that this particular virus latches onto. And that particular receptor does not grow in people until they're a little bit older. It doesn't mean kids don't have it or can't get it, but they're less susceptible. Right? So that's so kids below the age of 10 are less likely to get it and therefore less likely to transmit it. However, kids in the middle school and high school age seem to be just as susceptible to the virus and just as able to transmit it as adults. 2 different people told me that basically once you're over the age of 10 or 11, you're basically an adult when it comes to coronavirus. So that's certainly, as a father of a 10-year-old, that concerns me a little. Now, there is something to be said that the data indicates that not as many children are getting sick and not as many children are passing it along as adults. However, the Dr. Amelia Jones, who's a population scientist, told me that is very likely because kids have not been in school. It's not that they can't transmit it, it's that they haven't had the opportunity. Because we closed schools before it got bad, which apparently was the right call. We don't have any good data on what happens when kids are in school. So we'll learn a lot from the first couple months of school in those schools that open. It's also true that kids have, just sort of generally speaking, been more isolated throughout this pandemic, right? I go to the store. I don't bring my kids with me to the store. I sometimes have to go to work. My wife has to go to work. The kids don't come to work with us, right? And I think that's kind of the case for a lot of families. Now, I'm not saying any of this to make a case as to whether any particular school should open or close. Dr. AJ Sethi, he's an epidemiologist. He did kind of say, without making a recommendation, he did kind of say that local approaches might kind of make sense for this. That different localities have different conditions, and that it might make some sense, at least and he basically said it does make sense for local school boards, local politicians, local policymakers, local communities to kind of make decisions based on their own conditions. And that maybe a statewide lockdown might not be necessary at this moment. So if, so for some schools to be open might actually make some sense, because there are issues with having schools closed. There are equity issues. There are access to technology issues. There are childcare issues. There are job issues with closing schools. So it is a balance. But it is good just to have the facts that if somebody tells you that kids don't get this and can't spread it, that's just wrong. Kids can get it, especially older kids can get it and transmit it. And one of the reasons that they haven't, probably, is that they just haven't had the opportunity. It's also possible that kids, even older kids, don't spread it as much and won't. Also, you might have heard about other countries like Denmark opened schools and it didn't cause a big outbreak. And Dr. Sethi would say, he told me that you can open schools without a big outbreak if you have community spread contained. If your positive test rate is 1 or 2%, then you don't have a lot of virus to spread. So schools can open, and a school opening wouldn't necessarily cause a big outbreak when you aren't in the midst of a big outbreak already. So somewhere like Denmark and Norway, which opened schools and didn't cause a big outbreak, was because they already had the whole thing kind of under control generally. And there wasn't a lot of community spread. So Dane County is not there right now. Some other spots in Wisconsin maybe are. But Dane County, Milwaukee County certainly are not there. So that's, anyway, that's a lot of information. I'm going to write that up. So I will, tomorrow when I come back here, I'll have a link to share with you. You can also just look at the site, Madison365.org tomorrow morning. That'll be up. It'll have some good information. I hope that is useful to you. The other fun conversation I had, this is the life of a journalist, right? I had a call about nonprofit news revenue. Then I had 2 calls about epidemiology, and then I had a call about professional soccer. This is that's the reporter's life, and the professional soccer one was the most fun call of the day. I got to talk to Daryl Shore, who's the head coach of Forward Madison, our professional club here, which is going to start its season on Saturday. in Dallas and play an away match to North Texas. But then their first home match is the next Friday, the 31st, in Hart Park in Wauwatosa. Because of Dane County's regulations right now, you can't have more than 25 people even gathered outdoors. And you put two soccer teams together and their technical staff and the officials and the ESPN camera people, and that's 50 people. So they're playing their home games over in Wauwatosa. They had a nice conversation about the squad, about the roster, their optimism for the season. It's only a 16-game season. A normal USL League One season is 38 games, so it's going to be kind of a sprint through this season. But it sounds like they're in a good state of mind, and it's going to be a lot of fun to watch. Those games are on ESPN Plus. And then the home games are over there in Wauwatosa. If you haven't been to a Forward Madison game, I encourage you to try it out. I encourage you to watch on ESPN Plus. It's a fun league to watch. It's third tier, the MLS, and then USL Championship, and then USL League One. So it's sort of like basically the equivalent of like AA baseball, and it's really fun to watch. And the fans are passionate, and the team is good. The team was finished the season in fourth place last year, which got them into the playoffs. They lost in the semifinals to North Texas, which was the ultimate. They were the ultimate champion of the league. So they're the current defending champions is North Texas Soccer Club. And Forward Madison plays them first Saturday night. And it's fun to watch. So it should be a fun season. I will have that story up tomorrow as well, just sort of a season preview. If you check Madison365.org tomorrow morning. Okay, that's all I have for you today. If there's no other questions, I appreciate your attention. Subscribe to the podcast. Subscribe to It's Only 10 Minutes to get this sort of condensed overview of the news in just 10 minutes in your earbuds. First thing in the morning. Just go wherever you get your podcasts to and search for It's Only 10 Minutes. And I'm going to drop a link here to the show page. You can. I always I put each episode onto this page. So if you aren't a podcast subscriber person, you can still go to that page and just listen to the most recent episode. And same thing for Black Oxygen, which is a weekly interview podcast. That's a really fascinating listen if you're interested. At this, a lot of people at this juncture, as we're going through all this stuff with racial equity and everything, people wanting to learn about Black culture, about what it is to be Black, what it is to live in a place like Wisconsin, which is mostly white, as a Black person. Those are terrific interviews, really informative. You'll learn a lot if you just give that a listen to Black Oxygen. And if you want to support the work, we are a nonprofit newsroom, 501c3 nonprofit, so any donations you make are tax deductible. We will never charge you for the news. We think the news is a public good and should be available to everyone, regardless of whether they can afford to buy a paper or not. So we'll always be free, but you can help us keep it that way and help keep us going with a donation at Madison365.org/donate. And I might as well, so I'm going to drop links in the comments. I'm going to throw that one in there too. So have a great day, everybody. I appreciate your attention, and we will see you again tomorrow.